As of April the 8th, we have experienced 159 positive cases of the coronavirus in our parish, and unfortunately, we've experienced 4 deaths, and that is as of yesterday, the 8th of April. What our purpose in today is we want to brief the citizens of Bossier City on what we have been doing and will continue to do to deal with this pandemic crisis. We actually started our preparation as a city before it was officially declared by the president or the governor or CDC, and we were well ahead of the power curve, and I'll ask the chiefs, Chief McWilliams and Chief Watson, to talk a little bit more about these things as we get into the briefing. But we did implement the actions immediately when the presidential statements and declarations were made, as well as the governor's, about sizes of crowds and stay at home and don't go to work sick and all those things. We implemented those immediately, and I think we've been very successful in complying with that. We did decide which one of our employees did not actually have to be here, and we sent those non-essential employees home. Our public safety departments, police and fire, unfortunately, it's the nature of the beast that they have to work full time, but even the so-called non-essential employees are still working from their homes, many of them are, so, but we're still adhering to the social distancing and stay at home and all the other directives that we've received. City Hall is temporarily closed, but we are doing business as usual through telephone calls, through computers, teleconferencing, so on. So we are conducting the city's business with a very few staff in position in City Hall, but City Hall per se is locked down, but business is going on as usual. Our police and fire departments have continued to operate almost full staffing, and I'll ask the 2 chiefs to comment on that as they deem appropriate here in just a few minutes. Our police department also has, and Chief McWilliams will possibly elaborate on that, they have been helping educate our citizens and our businesses on what we should be doing in compliance with the directives we've received, and also monitoring, as has the sheriff and his folks, who is complying, but monitoring and educating people that what we should be doing to comply with the presidential and governors and CDC directives. And fortunately, in our calls for emergency medical service, we have not yet experienced the number of calls we thought we might, but we're prepared to deal with it, and Chief Watson will address that a little bit in his remarks. We as a community in Bossier Parish continue to meet telephonically almost daily. That's a group of approximately 25 to 30 people. They include elected officials, appointed officials, business leaders, medical staff, first responders, the military, and with also impact Dr. White and folks from the medical community. We go over this almost daily and how we as a community are addressing this challenge. We urge all our citizens to continue doing what you've been doing about complying with the social distancing, the size of crowds, and not coming to work sick and doing all those things that we hear every day, but they're absolutely critical that we continue to do this. We do not have any plans to implement a curfew at this time. We don't think it's necessary, but we'll revisit if Chief McWilliams and others decide we need to take a look at that, we will, but we have no intent to do that at this time. I was asked recently about the loss of sales tax revenue, and yes, that is a challenge, but we in Bossier City budget very conservatively and feel like that we have the wherewithal to get us through this crisis, and then as we begin to come out of this pandemic event, we believe that and as people go back to work and start spending again, we will recover some of that lost revenue, but we feel like we shall be able to survive this loss of tax revenue. We understand how terrible this has been on our business community, having to shut their doors and that loss of revenue, and those employees who don't have their jobs and those salaries. And we know also that the biggest loss, of course, is those people who've experienced deaths in the family and the impact on those families. And we especially want to recognize our first responders, both law enforcement, but all the medical staff and doctors and assistants who've done just a yeoman's job and have simply been outstanding and will continue to be outstanding as we deal with this crisis. I am confident that we will survive this challenge and we will recover this international crisis, but only if each and every one of us do what we have been instructed to do as we continue to address this pandemic crisis. And that said, I'll ask the two chiefs now to make remarks as they deem appropriate. And Chief McWilliams, our police chief, you're up first.
Thank you, Mayor. As Mayor Walker mentioned, the police department is working fully staffed. Fortunately, due to people self-quarantining and isolating and adhering to the social distancing, we haven't had the number of calls that we anticipated. Actually, our calls are down. Calls for service are down a little bit, and we want to thank the citizens for their cooperation and their participation in this time of having to self-isolate. Also, the mayor mentioned that we are not imposing a curfew, and that's due to people staying at home and self-isolating, and we ask you to continue to do so. And also, we would like to thank everybody for their support in this time. We've had many calls, many emails, trying to donate PPE such as that. We appreciate that, and everybody, I want to thank you for that. Thank you.
Okay, Chief Watson.
Thank you, Mayor. We've been very fortunate. Once the governor did do the self-isolation, we started very early with our dispatch, started taking calls and started asking questions. So we tried to have a questionnaire, so to speak, for people who we could ask questions. Have they had any, for coronavirus, had they had any symptoms, anything like that? So we started taking our calls, and we've had a decrease in calls also. So what we're doing is trying to provide our people with all the PPE that we can. We're trying to take all our precautions. We do appreciate what the citizens have done with just calling us basically for actually emergencies that are really needed for the ambulances. We're minimizing contact when we can, but we want to tell the citizens obviously that if they do need us, we're here for them to call, and we'll respond as usual. We've been very fortunate that we haven't had any employees that have been contacted or had the virus as at this point. So we're running a full staff at this time. So we ask that continue to do the social distancing and the isolation if possible, and continue doing what you're doing.
Chief, I would also like you to comment on what we have equipped in our ambulances so that as we transport potential victims of this, how we can sanitize the transport vehicle, and yes. Also I might ask you to briefly touch on the fact that Bossier City is known to have had this capability, and we were called to go down to assist the governor. And if you would
yes, sir.
Comment on that.
We were very fortunate. The city was able to, back in the Ebola crisis a few years back, we were able to purchase some machines. It's by Aeroclave from a company in Florida. And basically it's a disinfectant that you can plug into the back of the ambulance, and we have one on every one of our ambulances, and after each run you basically can plug it in. It takes about a 20-minute and it's basically mist the whole back of the ambulance. It gets on surfaces that you can't really rub or you can't really touch, and it mists and does the whole back of the ambulance. And we were fortunate enough to have a few spare ambulances. We have one on every ambulance, but we have one at every fire station. So if we have somebody that goes home sick, not from just this type of illness, but from a flu type illness or some kind of stomach illness or something like that, we usually want to decontaminate the station. So we were called upon from the governor's office. Our fire chief and one of our training chiefs went down to the governor's office and decontaminated all his cars, and they did the governor's mansion. So it was a real reassuring to him that his place had been decontaminated. So it's a testament to the city, basically, to give us the funds to be able to do that and to have that in place. And to be honest with you, if you tried to buy one of those machines now, it's probably about a 6-month waiting list to get that done. We already had them in place, so we were very fortunate to have that, to be able to do that. And thanks to the city and the city council to allow us to do that.
And so as we transport people with this suspected problem, by the time we transport them to the emergency room and get them in there and checked in, the ambulances are already being
Yes, sir.
sanitized. So
Yes, sir. By the time we have the patient inside the hospital and dropped off, one of the attendants has already started that process, and by the time the paperwork's done and somebody has signed for the patient, that the ambulance is clear and already been disinfected and they're ready to go. It takes about a 20-minute process, and we ask them that they let it clear out a little bit before they get in there, but it's ready to go.
And of course, Chief Watson is our head of our emergency medical service, and we have an excellent fire department, got an excellent police department that are serving our city well, and that's going to continue. Any last minute thoughts, gentlemen?